Last week, we showed you the first parts of Spotlight PA's investigation into our state's medical marijuana industry. And today, they wrap up their investigation looking into the quality of care that patients receive and the overseeing of doctors by the Commonwealth. Here's Mitch Blocker with a sneak peek at the final part.
Here's an exclusive Spotlight PA investigative report.
I'm Spotlight PA correspondent Mitch Blocker. Our statewide investigation into the Commonwealth's medical marijuana program has lawmakers calling for changes to protect patients. We dug into the state's top marijuana certifiers. These are doctors certifying more than 10,000 patients a year, some even more. In the end, the numbers add up to questions about the quality of care and how Harrisburg oversees Pennsylvania's pot docs. Pennsylvania's medical marijuana program has helped roughly 1 million patients since the first dispensaries opened in 2018. But a Spotlight PA investigation revealed the State Department of Health has done little to screen doctors who want to join the program.
What qualifies a doctor to prescribe marijuana?
You have to basically have a medical license that's in good standing.
Spotlight PA's Ed Mahan found doctors with histories of disciplinary action, including issues that could raise questions about their fitness, approved to certify patients. According to the Department of Health's data, a small number of doctors issue a significant share of medical marijuana certifications. Out of the roughly 1,300 doctors who certified patients for medical marijuana in 2022, most prescribed fewer than 100 cards, but 3 approved at least 11,000. That's an average of 30 a day or more.
People have concerns, though, about when you see that volume of certifications, what kind of care people are receiving.
One of those people is cannabis Dr. Charles Harris.
I think that that's medical malpractice because you're not really establishing a doctor-patient relationship.
Harris will certify about 1,000 marijuana patients this year. He believes that's a responsible number.
We get a reputation as cannabis doctors of being kind of, just a card factory. Those doctors that are, certifying 12,000 patients a year, they really, provide a lot of evidence to support that.
Health department officials caution drawing care-based conclusions based on the number of certifications alone. But some members of the state legislature want more oversight. 2 state representatives from Schuylkill County introduced legislation to give health officials clear authority. Their bill would empower state regulators to limit the number of cards doctors can certify.
I'm sure there's going to be a renewed push for legalization across the board in Pennsylvania. So I think understanding how the medical marijuana program is operating is even more important for those discussions.
Appreciate you, Ed. Thanks for taking the time.
Thanks so much, Mitch.
We will have the rest of that story from Spotlight PA coming up tonight at 11.